I'm going to be talking about working with osteopathic medical students in a busy clinical practice. Most of your osteopathic medical students probably want to maintain and utilize all of the OMT skills that they learned and perfected during their first 2 years of medical school. At first, it may be intimidating as a preceptor if you're not sure how long an OMT technique is going to take and how much time it's going to add to your already busy clinical practice. There are some OMT techniques that only take a matter of seconds, and they'll be able to offer a great amount of relief and benefit to your patients. Other techniques or manipulations may involve a little bit more time. I recommend that the first time you're working with an osteopathic medical student, you have them show you exactly what they want to do to the patient. So ideally, they'll show you where they're feeling some hypertonicity in the patient's body, where they're sensing some asymmetry, where they're picking up something that they think needs to be treated. And then they'll let you know, as well as letting the patient know, what the treatment is going to be, what it's going to involve, and what it's going to detail. And ideally, those first few times they treat, they'll do it right in front of you. And then you can see the difference to the patient's body. You can see that release of the hypertonicity of the muscles. You can see that improved range of motion. And you can talk directly to your patient about what benefits they may be feeling right away. As you get used to it, and as you get used to working with particular students, you may feel more comfortable allowing them to treat, even when you're not in the room. You should always go back in the room and check in with the patient and assess them and see how they're feeling. One of the ways that I like to work with medical students, and the way that I find is best in my busy clinical practice, is I have the student go in with the patient, they gather the history and physical on their own, and then they come and grab me. While they're seeing the patient, ideally, I'm seeing another patient in a separate room, able to complete an entire encounter, and then I can go in with the student, or I'm working at my desk, doing the paperwork that I need to catch up on. When the student's done with their history and physical, they come and grab me. I go into the patient's room with the student, and then I pull up our electronic health record, and I ask the student to present the patient to me in front of the patient. And then I take notes in the electronic health record. This is a huge time saver because if there are questions that I have that the student wasn't able to ask the patient or forgot to ask the patient, or if the patient's answer was a little bit unclear, we're able to elicit it with the patient right there. I also find that my patients really appreciate this because now we are being completely transparent. So it doesn't feel like there's a doctor and a student talking about them behind closed doors, but we're all in the open talking together. And then it's a great time for the student to be able to show me what they found during their osteopathic structural exam. So they can show me the areas of hypertonicity, the areas that they think have restricted range of motion, or what their other findings are. And they can tell me exactly what their treatment plan is going to be. If it's a student that I haven't worked with before, I'll have them treat the patient in front of me, and I'll have them tell the patient directly what they're going to be doing, what their plan is. So whether they're going to be helping to increase the range of motion or helping to decrease the hypertonicity of the muscle, I'll have them explain their techniques to the patient so that I can hear it as well. And then as they're practicing the techniques, I get to watch and make sure that the patient is completely comfortable the entire time and that the treatment is adequate. And then afterwards, we talk to the patient about the different expectations, the importance of drinking lots of fluids after they've had osteopathic manipulative treatment, the importance of potentially taking some NSAIDs if they do have some inflammation in certain areas, depending on what their problem is. If you have any questions about what osteopathic manipulative treatments would be appropriate for your patient, or if you have any questions about your student's skills and abilities, feel free to contact their osteopathic medical school so that we can help you to feel more comfortable with these modalities. Thank you so much for precepting our students. We are incredibly grateful for that, and we appreciate what you're doing to give back and to help provide to the future of medical education and to healthcare in general. Thanks so much.